will talk about the first medical evacuation in space, crew of 4 astronauts who have safely reached from ISS module. NASA has carried out a historic first, completing the world's first medical evacuation from space after astronauts aboard the International Space Station were brought home early due to a health concern affecting one crew member. In a rare move, the SpaceX Crew Dragon Endeavour carrying the Crew-11 astronauts splashed down safely in the Pacific Ocean off the coast of San Diego early Thursday morning.
After discussions with Chief Health and Medical Officer Dr. J.D. Polk and leadership across the agency, I've come to the decision that it's in the best interest of our astronauts to return Crew-11 ahead of their planned departure. Within the coming days, the Dragon Endeavour spacecraft will depart the International Space Station with Commander Zena Cardman, pilot Mike Fincke, Kimiya Yui from JAXA, and Oleg Platonov of Roscosmos, and safely return them to Earth. We expect to provide a further update within the next 48 hours as to the anticipated undock and reentry timeline.
The multinational team, including NASA astronaut Zena Cardman and Mike Fincke, Japan's Kimiya Yui, and Russian cosmonaut Oleg Platonov. They had been on the ISS conducting a scientific research and station maintenance when NASA made the decision to bring them home more than a month ahead of their planned Feb return. It was NASA's January 8th decision to cut the mission short after a serious but stable medical issue emerged involving one of the crew members. Out of respect for privacy, officials have not disclosed the name of the astronaut or specific nature of the condition, but have emphasized that the individual is stable and being cared for. This marks the first time in the ISS 25 years history that a mission has been ended early due to medical reasons, underscoring how critical astronaut health is in long-duration space flight. The return was deemed precautionary rather than an emergency. NASA followed standard splashdown and recovery procedures, with recovery teams staging in the Pacific to retrieve the capsules and provide medical evaluation as soon as the astronauts were safely aboard ship. Before the decision to come home early, a planned spacewalk was cancelled and station operations were adjusted to prioritize the healthcare response. Crew-11 mission, which launched in August 2025, was also part of a broader era of international cooperation aboard the ISS, with US, Japanese and Russian crew members working together on experiments in microgravity, human health research and Earth observation. As the astronauts touched down off California, weather conditions were favorable, allowing for smooth re-entry and parachute-assisted splashdown early Thursday. Recovery helicopters and boats were hand-on and quickly brought the crew safely ashore for post-flight checks. NASA Administrator Jar Isaacman said the decision to return the crew early reflects the agency's commitment to astronaut safety above all else and highlights the challenges of providing comprehensive medical care in orbit. Scientists and engineers will now review the procedures and medical protocols that made this unprecedented evacuation possible, lessons that could be vital as NASA prepares for future missions, including its Artemis lunar program and longer stays in space. For now, the space agency and the families of the Crew-11 astronauts can breathe a collective sign of relief. All 4 are back on Earth safely, reminding the world of both fragility and resilience of human space exploration.